and we look at certain traditional contributions or themes in abnormal psychology, we look at a very old theme, and that is known as the spiritual approach. This was the earliest approach, which basically said that people, if showed any abnormal behavior, that was in the past considered due to influences by possession by evil spirits, and different acts and actions were done on these people to release this evil from the body. And generally it was seen in the past that women were more common targets of this kind of persecution. Now we moved on to a more humanitarian approach, which is towards the later half. We've seen that in early 1800s the condition of people suffering from mental disorders was terrible, and people were just put in asylums, and things just worsened because there was overcrowding. There was really no care taken of people suffering from these mental disorders, and this was considered more as a punishment. But as we moved to the 1963, things became more institutionalized, and contemporary advocates came into and suggested new compassionate forms of understanding this disorder, and of course coming up with more compassionate treatments. And a lot of people worked together as psychologists, psychiatrists, to work towards changing people's perception towards the mentally ill people. Moving on to a more modern scientific approach, which is basically the first time where we looked at a psychological disorder as a severe mental illness, and we wanted to look at what would be the medical or the medication process of solving these problems. Now we have different researchers who worked on their contribution, but we basically spoke about in 1950s, where we said that there should be certain paralogical treatments that need to be invented and worked on, and to help these patients. Now as we move to the the 20th century, we came up with a very positive approach to mental health study, and that we called it the positive psychology, where we said that we really need to focus on prevention of these mental illnesses rather than just looking at the intervention or the cause. So moving on